Hello.
Audible there, sir. You can speak.
Morning, everyone. Today we have a case of a young man with a ACL tear, bucket handle medial meniscus, and a lateral meniscal tear. What we have done is, so far we have harvested the graft. We harvested a semi-T graft. We quadrupled it, and the length we got was around to the left hand. To the left hand.
No, left. Take left corner.
So we got around 60 mm graft, 8.5 diameter. So we have got a good graft. What we have done is we have reduced the bucket handle and we have fixed the bucket handle with, as you can see, 2 outside in sutures there. Yeah. And this is our second all-inside which we have fired in. So the plan is to do a meniscal tear, meniscal repair, and then go for the ACL. That is my normal this thing. I know various people, they have different ways of doing it. Many people would finish their ACL tunnels to the left and then do the meniscus. But my contention is, you see, a meniscus repair can give way. So what I want is, if it gives way intraoperatively, not left eye?
Left.
Okay. So it has to give way intraoperatively. So if your repair doesn't work, then you have to know about it intraoperatively, not postoperatively. That is the reason what I do is, I do all my meniscus first, and after doing my meniscus, then I do the, इसको pull करो, pull करके रखो. After I do my meniscus, then I do my ACL tunnel. Now the contention is, if the meniscus is stable, after I do my ACL tunnel, then I don't need to worry about my meniscus. It is very stable. I do proper cycling after ACL. So these are the all-inside devices that you are seeing. For ACL, we plan to do suspensory fixation on both sides, on the tibia as well as on the femur. That way what we can do is, so there you are. We have a problem with one of the implants. Can I have a punch?
Yes, sir.
ठीक है, it has come out. Grasper.
Yes, sir. Yes, sir.
Can I get my needles to do all in outside in sutures?
Yes, sir. Ready. Okay.
One more needle, please, sister.
Yes, sir.
Probe देना. Lift the leg up a bit, it is coming in my way. This is coming in my way. So you need to give me more space. Loop.
Yes, sir.
So we pass a loop through the proximal needle. 1 minute, sister, 1 minute. And a nylon suture through the other loop, through the other needle. That's fine. Do it.
Yes, sir.
Just lift the leg up. Yeah, that's it.
Okay.
Okay. Yeah. Thank you.
Loop on the corner. Loop पे धक्का मारो.
Yeah. We'll do that. Yeah, that's it. You can use an inside out technique as well for this part. No, no, if you push the needle down, then everything goes down. Push the nylon in, nylon in. ये पकड़ना, ये पकड़ना है. Just 1 minute, sister. It is through the loop.
Yes, sir.
पकड़ना. Good job. So what we are going to do is, once we finish this, we'll check our lateral meniscus and then start doing the ACL. Gently, gently. Yes. So these sutures will secure our meniscus. We'll also put in more sutures to secure the medial meniscus. Take everything out. Take this out, figure of 4. Figure of 4. You see there is no ACL there. So figure 4. That is the lateral meniscus. Unfortunately, most of it is gone. Push the knee down. Should I?
उधर जाओ उधर इस तरफ आओ पाँव उठाओ जोर पड़ेगी तो अभी जाओ डॉक्टर बोलेंगे
Okay. Figure 4. Shiver. Come down. नहीं स्पेस ही नहीं है हाँ छोड़ो हाथ छोड़ो Probe.
पंच सेट रख लेना
Yeah, you can see there it doesn't look great. The lateral meniscus. There is a horizontal tear. What we'll do is we'll debride this white zone and then we'll close this gap with a couple of all-inside devices. ये लेना सिस्टम श्योर स्टिच ओपन करना 3
ये ओपन है एक ओपन
दबा मत ट्रो कर देना सिस्टर या फिर 11 नाइफ दे दो एक बार
और नाइफ भी
आर्टर क्लिप और या फिर सीजर्स दे दो Okay, fine. Yeah. Fine, okay. Yeah, okay. We'll do the femoral tunnel. Shiver. Shiver, shiver. Give me all. No, I don't need to. So I do a freehand femoral tunnel. I don't do a